Cooke, who's the Chief Executive Officer of the Community and Health Services Industry Council. So Rod, if you'd like to come up and provide us with your wares for this afternoon, that'd be great. Thank you.
Hopefully this one's working, so good afternoon. If I cough and splutter, I have to apologise. 5 weeks ago I had a flu shot and it's worked ever since. I think there's a bit of a collective. I was talking to Stephen Conway and he's sputtering as well, so we'll have to see who can out-cough each other during the afternoon. Look, I just really wanted to come and talk a little bit about the needs of industry. And after a couple of the sessions I sat through in the day, you might say, what's an industry skills council who develops those dreaded training packages that everybody hates? Why is he talking about the needs of industry? So I have a different perspective on life than some of the earlier presentations, so I'll hope to show what some of the benefits are. Because, of course, my experience is from industry. I think I added up, I've been in about 12 different industries, I've had 10 different employers, 20 different jobs, and I'm in my 4th and 5th careers as we speak. So I think I've got a pretty good broad breadth of experience, understanding in industry, private enterprise, not-for-profits, and I think training packages are doing a pretty good job. And I'll talk about the health and care context, of which the one at the moment I think I can speak a little bit more authoritatively about. So the theme of the conference was about meeting the real needs of business. So that's the perspective I want to look at, to say, how do you get the best out of your employers and how do you get the best out of training your staff and training your organisation to succeed? And I'll use a couple of examples that we've been working with and a couple of projects that are happening here in Tasmania in aged care as some of the examples. So the aim we're really talking about is just that training standards. I don't, as an IC, get up in the morning and say, I want to have a set of competency because that's what I read in the back of my Wheaties packet. We work very closely with industry to develop what they want. So these are job standards, packaged into units of competency and qualifications that industry wants us to develop. So we don't go out and make them up. We do work with employers. And so these training standards are developed with employers, not only to look at what is currently required in business, but what the future requirements are. And if we have some time to diverge, I could talk through the unknown that is the National Disability Insurance Scheme, that nobody really knows what aged care is going to look like in 5 years' time because they're undergoing fundamental change and reform. So whether they fit into a Type 1 or a Type 2 organisation, they've been there for a long time, they're going to be there for a long time. And in fact, 1 in 4 jobs from now and forever in Australia are going to be in the health and care sector. So there's a need, I guess, to make sure that the training and the relationships are done correctly. So what I want to talk about is just look a little bit at training standards. And as I said, we don't just pick these out of the blue. We have a very, I guess, detailed process that we work with a number of layers of industry to try and find out what the real answers are. One of the challenges is the health and care sector is the largest workforce, with about 11% of workers in Australia. It's the fastest growing workforce, and some of the numbers are quite scary. I'll get to the aged care numbers later, and they're a little bit frightening. And so it's very hard to get to everybody. Across Australia, we deal with 65 different sectors in the health and care space, and just those 65 sectors we can't afford to engage everywhere. So we tend to work a lot with peak bodies, with industry associations, with unions, with large employers to try and get that scope done. And we have a layer, as you can see, and some of you have probably been involved, of consultations. And in fact, next month we're coming to Hobart as part of our national round of consultation on some of the training package work that we're doing. And if you want to get involved in that, I'll show you a website later on where you can have a look. And we have, unfortunately, it's a bit laborious, and I'd have to agree with some of the speakers, the bureaucracy around this is a bit frightening, though we've got to wait and see how the new federal government goes, because the group that inflicted this model on us got disbanded, and we don't know who the new crowd is yet, so the National Skills Standards Council will be reborn in some way, and hopefully we can speed up some of the arcane methodologies we have to go through. It was always quite interesting when you play at the political level. Susan Lee, who's the Minister for Childcare, we've had a long battle over a number of years, because when we worked with a national regulator, when the new childcare regulations came in place, it took us about 3 years to go through this process to make sure we consulted with everybody around Australia to come up with a new job standard. Now, is that good enough? Is that quick enough? Probably not. but it was the reality of the process we had at the time, and hopefully we can cut some corners and speed up some of those processes. So what I talk about when I talk about employer-led training is really this, that I don't think you can do any effective training unless you're partnering with the employer. The employer has to lead this. Training should only be done where it helps the business meet its strategic goals, its aim, or whatever its aspirations are. So I always get amused of when there's training funding that happens around the place that goes straight to RTOs. Without needing to apologise, I think that funding going straight to RTOs, unless they've got a really good relationship with an employer or a business, is just wasted money. And so how do we get tripartite arrangements going where employers and RTOs and the funder can get together to make sure that those arrangements are happening? And I know Tasmania is doing some things around quality marks to try and tighten up its use of application of its funding. So you're going to start with these sorts of things. So there should be a needs assessment to understand what sort of training is required, what sort of employees are required, how do you get them. Some of the aspects that were spoken about earlier, the VET system has never claimed to be all to all people. It's pretty good at knowledge and skills, and some universities would argue it's not that good at knowledge, but it's pretty hopeless on attitudes. And so a VET qualification will not give you the employee that can perform on day one on the job. If an organisation hasn't got a strong induction process, orientation process, performance management process over a long period of time, you're not going to get people up to the performance standards you want. And the VET system can't do that for you. The VET system can only give you a piece of the puzzle that you need to build your workers' capabilities and your organisational capabilities. So of course we want to make sure there are work systems in place to support staff as they undergo learning, not just initial learning but clearly ongoing learning, because the jobs are changing. Even in aged care, for example, where July 1 just about go through a significant change of reform in aged care, different funding models, the introduction of consumer-directed care, the work of any aged care provider will fundamentally change. So how do we make sure that the people who are in that job already can make sure that they can pick up the new skills, the new knowledge, the new attitudes or culture, whatever is required to help that business or that organisation transition to the new reform, meet the new funding requirements and deliver the consumer care that they're required to do. Work placements is really important, and I was interested to see the Comstar example about how they do integrate that into their workplace. One of the things I find absolutely fascinating, and it's due to Australia's funding system, if you're doing a nursing degree, for example, the Commonwealth will give an employer $30,000 for a work placement for that under-training nurse. How much money do you get for a VET placement? Yeah, you're right, the answer is nothing. So we have a system that's already happening in aged care and community sector where the university sector are starting to buy the way into experience placements that used to be given free to the VET system. So we have some unintended consequences of our funding models. And of course, how do you support the trainees through their learning process? RTOs, I think, have a bigger role. I find it interesting that people offer just qualifications. I think an RTO needs to become a business partner, and it's almost getting the consulting model of, unless you know what your employer's goals, aspirations, strategy and business model is, you're not going to be able to sell them a solution. So you need to work closely with them to understand where they're going and help package the training to them. Because of course, as has been pointed out, the VET qualification can be a little bit cumbersome and a little bit locked in. Though in our sector at least, we're trying to make them more fluid and open them up to give a broad reach of qualifications for a wider number of employers. But there is always room in there to pick different units of competence, and you don't always just have to have a qualification. You can use just units of competence or skill sets, or even training that's outside of the training package. And again, some of the barriers between the skills council areas is true, though we do poach a lot, so you can bring units of competence from other qualifications into the sector that you're working in. So for me, it's about workforce development, not just about training. When I was in my corporate training and human resource development gigs, I've worked with some big companies, NRMA, Integral Energy, Australian Army, running their training systems. My stock standard was training won't fix your problem. It never does. It's generally management, but that's 80% of the cases, but we'll leave that one alone. So training, unless it's provided with a whole range of other solutions, such as culture change, such as systems, such as environment, such as leadership, such as feedback, it's not going to work. And the same with the vet qualification. Unless you encompass around a wider system around that training, you're not going to get its maximum effect from it. And from an employer, when you're spending money and you're getting some money from us, the taxpayer, perhaps to deliver the qualification, everyone's interested in making sure that the training is the most effective. It helps the employer and the employee out and goes to yielding some productive outcomes. So, of course, you want to put the systems in place, and that's workforce development. So what is workforce development? I guess the language we use is bigger than training, as I said before, about strategic planning, HR, workforce planning, community capacity, and I'll talk some more about some of our views on how you go about getting some regional models, because I think they're, as John Buchanan pointed out, the Narrabri model. We've got some examples that we've been using and implementing to great success, and I think there's some great potential there, but of course it's where you get the money from to make it happen is some of the challenges at the moment. And it's about capacity building, because of course, as I said before, we know that the qualifications we have now are probably going to be irrelevant in 3 years' time, because the job role will have changed so much. And one of the problems with our current vet system is how do we have the flexibility to allow people to build up. So you may still have a qualification in aged care, but what you're doing in that qualification may be significantly different. And how do we put those in place? Because we don't want to pull everybody off the job and send them to off-site training again. How do we integrate the learning and ongoing process into a workplace so that the employees can work and move with the organisation to adapt and change? These are some of the things that we talk about workforce development, about what it should do, and some of the things that we think from the literature shows what successful workforce development is. So I won't go through those in any great detail. So why do it? To me, it's about return on investment. We want to be getting, as any business, dollars are valuable. So you only want to spend money where you can get a good return. So how do you get a better return? It's looking at getting your workforce development return on investment. So it's looking at getting good staff, recruitment and retention. And it's not just about the qualifications, as I said before. It's about the right fit, understanding the culture, having the right attitude, having the right attributes to be able to come into the organisation. It's about how do you look at getting workplace cultures, because they're some of the main drivers. Some of the research shows that culture is has the most impact on organisational performance. Not the training, not the skills, not the qualification, but the culture. So how do we work with that? And one of the things that's going to be a larger part of the future is increased productivity. In the health and care space, the costs are growing. It was interesting, I was meeting with the previous National Health Minister in December. She was the Health Minister from the previous government, and I used to use my little scary tale of within 20 years every state government's entire budget is going to be spent on health and care. And Tassie hit that hurdle about 3 years ago, and she said, no, it's only 5 years. So we have a crisis in Australia that's only 5 years away, that our health and care costs are rising so quickly, so far beyond CPI, that unless we adapt some new models, unless we become more productive, we have a challenge. Because there's not going to be lots more money into health and care, even though the budgets are still growing, but we can't afford as a society to keep pumping money into the stage of growth that it is. So how do we change that? And that's been looking at organisations and people in this system becoming far more productive. So some of the future directions, we think some of the things you need to do is, how do we work in an ageing workforce in the health and care sector? The workers are 47 female and working part-time, and in 20 years they're going to be clients. So how do we do that? And I think there's some positives in that. We shouldn't be saying that's gloomy. We should be looking, because I'm in that age group, we should be saying how do we make the best out of our more mature workers and recognising the great attributes and benefits that they bring to a workplace. Spoke about doing more with less and clearly changing client needs. Consumer-directed care is a revolution that the health system hasn't woken up to yet. When you as a consumer can choose how you spend your slice of the healthcare pie and choose where you want your services, it's probably not going to be the way it's done now. If you're in an aged care facility, you don't want to go to hospital because you die when you go to hospital. So you want to stay in your home or in your community or in your facility and have the services come to you. And often our health and care services don't support that. The big scary numbers, we need to find probably 700,000 to 800,000 extra aged care workers. This is just aged care. over the next 20 odd years. How many people are there on the dole queue in Australia? Anyone know? About 350,000. So even if we got everybody out of there and got through the multiple barriers that people have to returning to work, there ain't going to be enough. And the pay is pretty poor compared to the rest of the sector. So what's going to be our solutions? I have an Indian delegation wanting to visit me next week, so I suspect a lot of those are going to be overseas workers that come in specifically to provide that care that we can't provide. And of course, spoke about the ageing model, and of course, how people are responding to the aged care reform that's happening at the moment. And I'll speak a couple of examples. Some of the things that we're doing and we've had funded is firstly about leadership. The first thing you've got to do, and it's a bit sad to say for me, who's somebody who promotes training packages, the first thing you've got to do is make sure there's good leadership and management in an organisation. Because you're not going to be able to cope with reform unless you've got leaders who can help scope the reform, work out where we're heading, and bring the organisation along with it. As some of the, as the comm staff spoke about, it was about the leadership and the direction that they had. So we've put together, working with industry to put a framework together for leadership. And if you're interested, you can get through it through our organisational website. And of course, the federal funding we got runs out in about 3 weeks. But we're working with the 2 aged care peak bodies nationally to own that system and to carry that forward. And we've got about 450 aged care leaders around Australia who've engaged in it. The other interesting piece in getting to the regional solution is we've had an aged care workforce innovation network, and there's actually one in Tasmania, and Lee Veach is hiding around the room somewhere, is the coordinator for that in Tasmania, working with the Aged and Community Services peak body here. And so what we did was we picked 10 regions around Australia and we put a coordinator in that region to get anyone interested in aged care in the room to say, well, what are the local problems, what are the local challenges, and how do we solve them? And going back to the John Buchanan spoke earlier about the Narrabri model, that's our version of that, that we went into some regions and areas and tailored local solutions, and I'll talk a little bit more about that a little bit later. We're also managed to get some funding for the disability sector, so the 6 National Disability Insurance Scheme pilot sites. We are funding the peak body for disability, National Disability Services, and they're going to be running a similar program. So shortly there will be a disability workforce innovation network set up in Tasmania to help the disability sector look at what's the future of the reform. So some of the opportunities we think there are is to look at how to work collaboratively. So getting employers, employees, training providers, service providers in the area to work together to come up with some local and regional solutions. And it's interesting, a lot of the projects that have come out of that, and I'll speak about those, has actually been about trying to find new workers, how to recruit people, because they're struggling to find the right people with the right attitude and the right skills. Some of the other things that we've done is to get the employers and training providers to work together, and Tasmania's got a couple of great examples. The Tasmanian Clinical Education Networks working across the universities and the RTO sector to look at some models for the whole health and care system. And there's also some other examples that aged care have been working on for about 10 years here, so that was pre my funding time, to look at building some partnerships between RTOs and employers, and they've got a new directions program that's helping to recruit people into the aged care sector. So again, some other opportunities. It's looking about, the interesting thing is when we talk about productivity, there are no measures. You'd think that health and care would be really good at measurement, and it's not. And in fact, what were the national measuring bodies have just been all closed down in the federal budget, so I'm not sure who's going to be doing the measuring of the limited bit that we did. But what is productivity and how do we measure it? Because we need to start thinking about what are some measures and how do we move towards that. One of the earlier speakers spoke about language literacy, the biggest blight on our society, and unfortunately the federal government has just closed the WELL program, which I can't believe. Anyway, we'll have to keep on working on that. But when 2/3 of the workforce don't have the numeracy and literacy skills to do their current job, and again, we had some presentations earlier that spoke about the increasing use of technology and adaptability, and that's going to hit the health and care sector as well. So how are people going to cope when they're suddenly expected to do more demanding roles with greater use of technology and equipment? Then how do we make sure they've got the numeracy and literacy to be able to keep up with that? So some of the other opportunities we look at is also just how do we get opportunities going. So change is intimidating, It is a challenge, especially for organisations that have been doing things in certain ways, for example, disability or aged care. But change is also an opportunity, and so it's how do you get that entrepreneurial, innovative capacity in, I guess, traditional service organisations to think about where is this going and what are we going to do. For example, in disability, if you're a disability provider, you get your block funding in advance to do a certain range of services. Under the NDIS, you're going to get funded in arrears for individually tailored solutions for your client base. Now, that's pretty revolutionary. And I don't think the disability sector has actually got its head around it yet. A review was done of the NDIS rollout, and the analogy they use is it's like building an aeroplane after it's taken off. So there's a few challenges in that space, but change is an opportunity. One of the couple of things we've done in our local aged care network here in Tasmania, we've done two things. Not only set up the network to allow the collaboration and the cooperation, but we did two things. One, we did a business review of those if the business wanted it, and of one of the findings out of that business review, we have co-funded a solution for that. So if somebody said, I need a strategic plan, we've dollar for dollar up to $20,000 for that business so they can build that strategic plan. So of the reformative reviews, as we call them, we've had about, out of the 17, 16 have received funding, and there's a whole range of systems between risk and financial management, strategic directions, quality. And if you want to know more about it, find Lee Veach a little bit after. She can talk in great detail about that. And we've also got some collaborative grants for the region to work on. And so they're doing some collaboration to look at strategic direction and also looking at leadership development. So there's some collaborative models that we've been funded as well. They're also doing, which Tasmania's been doing for a while, attraction, recruitment, retention, career pathways. And there was a conference, was it last week or next week? Last week, in Launceston, looking at technology in aged care, which we helped fund and helped organise. So I guess to summarise some of the key points, from our perspective, effective training is about meeting the needs of business. So it can't be done in isolation. It can't be done just focusing on the qualifications or the competencies on its own. It needs to look about how is it integrated into the business, how does it meet the business needs, and how do the employers and RTOs work together. We think local and regional collaborations are a way to go. There have been some successful models. The challenge is, of course, getting the funding and support to continue those models. And how do you build the capacity of local collaborations to keep working? And Tasmania has been very successful at that. Some of the other states could quite clearly learn from that. But again, one of the challenges when you look at national solutions, at the moment our vet system is fragmenting. So every state has got different funding priorities. And I could scare you with a big chart about how every state has a radically different approach to what is funded, how much they're going to fund, and how much support they're going to give. And when you have a national challenge, such as rolling out a national disability insurance scheme, how do you get the states to play along and have some, I guess, similarities across different states, so at least national providers can have some consistency in how they resource and develop their staff, and so there are no barriers put up between the state divides. Final thought, I guess in summary, it's saying investing in your business means valuing and investing in your staff. And in your organisation, how can RTOs and employers work better together, and how can RTOs provide better support? So, in summary, I guess meeting the real needs of business from our perspective is getting employers and RTOs to work together to understand both of their needs and requirements, and to support the employer to achieve its goal, achieve its strategic vision, and to help improve its productivity. If you want to know a little bit more, and I guess to find some of the things I've spoken about, the Workforce Innovation Network, the leadership, you can get that via our website, and there's a whole bunch of other social media type things that we have lots of stuff on there if you want to see what we're doing and how we're doing it. And hopefully these presentations are going to be made available for those who have been snapping away. So in summary, that's our perspective of life. I think that the vocational education and training system still has a fundamental place to play. It is valued from the feedback and the people that we work with, but clearly with any system there are things that can be done to improve it, and we'll hopefully see how this new federal government goes on trying to reduce the red tape, which I think is badly needed, but the jury's out at this stage. Any questions? Nope, I've stolen your bit, sorry.
That's all right. I don't think there's any questions.
Excellent. Thank you.
Thanks very much, Rod. Now, before we